Hello, I'm Hallie Wooten. I'm going to be doing the medication administration checkoff today. So here is my badge. I'm just going to do a quick scan of the room. So I would plan medication administration to avoid interruptions. I would close the door to the medication room. I would not take any phone calls, and I would limit conversation with my colleagues to essential information only. And I would refer to the agency no interruption zone policy. So the first thing I'm going to do is I'm going to compare the patient care order form with the MAR. So the right patient, Jaguar J. Jones, Jaguar J. Jones, date of birth, August 25th, 1963, August 25th, 1963. The right medication, so heparin, 5,000 units subcutaneously every 12 hours. Heparin, 5,000 units subcutaneously every 12 hours. The right indication would be for DVT prophylaxis. And I can see that my patient does have an allergy to penicillin, so penicillin. And so now I'm just going to be using my MAR to move on. I'm going to perform hand hygiene, and I'm going to do the first check of the 7 rights of medication administration. So, right patient, Jaguar J. Jones, date of birth, August 25th, 1963. The right medication is heparin. So, heparin. Alright. And I can see that my medication is not expired. Alright. The correct dose is 5,000 units, and I can see that on this heparin vial it says 10,000 units is 1 milliliter, so I would be getting half a milliliter for 5,000 units, and I would also just want another nurse to double check my calculations. The right route is subcutaneously, and I'm going to be using a tuberculin syringe. And the right time is every 12 hours. The right indication is for DVT prophylaxis, and the right documentation is it has all the elements for a legal prescription order. So now I'm going to be cleaning off the top of my vial. And I want to make sure not to touch the top of my vial after it has been cleaned off. So I'm going to open up my syringe, take the cap off, and I want to get my half a milliliter of air. Alright, so I'm going to inject it into the heparin. And I'm going to be drawing up my half a milliliter or 5,000 units of heparin. Alright. So I do have my half a milliliter. Alright, so I'm just going to put the safety on, and I'm going to move on to the second check of the rights of the 7 rights of medication administration. So right patient, Jaguar J. Jones, date of birth, August 25th, 1963. Right medication, we have heparin, right dose, 5,000 units, so which would be half a milliliter. And I do see that I have the half a milliliter on here. Right route would be subcutaneously, and I have my tuberculin syringe every 12 hours for the right time. And I can see that my patient has not had their heparin, and right indication would be for DVT prophylaxis. And right documentation would be that it has all the elements of a legal prescription order. So now I'm going to write my label for my syringe. So I'm just going to include the patient name, which is Jaguar J. Jones. The drug, which is heparin. And 5,000 units, which is the right dose. Now I would just put this on my syringe. Alright. And so now I'm going to go into the patient's room with my MAR, my vial of heparin, and my syringe. So I'm going to perform hand hygiene, and I'm going to explain the procedure to the patient. So, hello, I'm going to be giving you your heparin today. I see that you haven't had it yet. And I'm going to raise the bed to a working height and lower the side rail. I'm also going to begin my third check for the 7 rights of medication administration. So, right patient, I'm going to be comparing it to the armband. So, our patient is Jaguar J. Jones. Jaguar J. Jones. Date of birth is August 25th, 1963. August 25th, 1963. And I can see that you have an allergy to penicillin. Do you have any other allergies? No? Okay. So, now I would take this time to perform any pre-assessment procedures that I would need. And now I'm going to move on to write medication. So, heparin, then we have our heparin, and then the right dose, 5,000 units, which would be half a milliliter. The right route is subcutaneously, and some good sites for subcutaneous would be the abdomen. And right time is every 12 hours, and I can see that he has not had it yet. And right indication would be for DVT prophylaxis, and right documentation would be that there are all the elements of a legal prescription order. And so now I'm going to perform hand hygiene, and I'm going to put on my gloves and my goggles. Alright, so now that I have my gloves on, I'm going to be taking an alcohol swab, and I'm going to clean the patient's skin, making sure to not go over an area that I've already gone over. And now I'm going to remove the safety on my needle. And I'm going to pinch my skin. I'm going to be doing 90 degrees, so I'm going to be pinching 2 inches. Alright, and I'm just going to put this quick stick in. Alright, and I'm going to be injecting the heparin over 30 seconds. Alright, so I'm going to take this out, remove the pinch, and this is going to go straight into my sharps container. And so now what I would do is I would position the patient comfortably. I would assess for any pain or, well, not any pain, but any like allergic reaction. I would put the bed to the lowest setting, and I would have also patted gently after I gave the injection on the injection site. And so after I would have patted gently, I would have assessed for allergic reaction, lowered the bed to the lowest setting, raised the side rails, made sure the patient was positioned comfortably, and now I'm going to be removing my gloves and my goggles, and I'm going to perform hand hygiene. And now I'm going to go document. So I would document the 7 rights of medication administration, and I would document how the patient tolerated the procedure. And later on, I would come back and I would come to check up on my patient to see how they were doing after their injection. So that's going to conclude my medication administration checkoff video. Thank you.